Hello, my good people. Every day is a new dawn. Every day we have a new topic. The question is, how many diseases do we have to discuss in this channel and for how long? The answer is so simple. Diseases are so many and we'll continue discussing them as much as we can and as much as God gives us the grace. Welcome back to my channel. Since yesterday we have been discussing about adenitis, and before we continue, let me appreciate you for the support you are giving me, more so the subscribing. This channel is growing so fast, and it's through your support that I'm where I am at the moment. So let's continue subscribing, liking and sharing our videos so that our channel, it's our channel, not my channel, because without you, I don't have a channel. So let's continue subscribing, liking and sharing so that our channel may reach the whole generation and the whole world. Let's get back to our point of discussion, whereby we are discussing about adenitis, and in this video majorly we will be discussing about mesenteric lymphadenitis diagnosis and how it can be treated or managed. This is one of the serious areas which can be affected by adenoids or adenitis after the neck. So, to diagnose your child's condition, your doctor will ask you the child's medical history and perform an examination. And the tests that will be done include the following. Number one, blood tests. Blood tests. Certain blood tests can help determine if this child, or if your child has infection and what type of infection it is. You have to run laboratory tests for you as a doctor to come into a conclusion this child is having this kind of a disease. So the test will help determine if the child is having an infection and what kind of an infection it is, so that you may be in a position to prescribe or to give the right medication. Number two, we have imaging studies. Imaging studies. Abdominal ultrasound is often used to diagnose mesenteric lymphadenitis, and also with the CT scan or computed tomography of your child's abdomen might also be used. Those are the main tests or the main ways that a doctor can use to diagnose your child or to identify the disease, if it's mesenteric lymphadenitis or any other kind of a disease. What are the treatment options or regimens that can be applied in mesenteric lymphadenitis? So, mild and complicated cases of mesenteric lymphadenitis are those caused by virus and go away by their own. Though full recovery can take up to 4 weeks or more. So, some of these infections caused by bacteria, as we have been discussing, your immune system can fight a virus. So, if the cause is virus, your body will fight this kind of a disease by itself but in uncomplicated cases, all mild and complicated cases. So they will go away, but full recovery may take up to 4 weeks or more. For treatment of fever or pain, consider giving your child or infants or children over-the-counter fever and pain medication, for example, acetaminophen, into brackets, Tylenol, or Brufen. Antibiotics can be recommended for moderate to severe bacterial infection. I hope you get that. So, a question to ask: what are the lifestyle and home remedies for mesenteric lymphadenitis? Or what can be done basically at home or locally at home to correct or try to rectify mesenteric lymphadenitis? For the pain and fever of mesenteric lymphadenitis, how your child is presenting, you can do the following. The measures you can take at home, or home remedies you can apply to assist this child include the following. Number one, give plenty of rest. Help the child recover by giving the child plenty of rest. Number two, give enough fluids. This will help prevent dehydration, which might be caused by fever, vomiting, and diarrhea. And the last point, apply moist heat. Apply moist heat. Warm, moist washcloth applied to abdomen can help ease pain and discomfort. Warm, moist washcloth applied to the abdomen can help to relieve discomfort and pain. Remember, it's a warm, not cold. So, this marks the end of our discussion about adenitis. It was a short topic, and I hope this person who had requested it has got what he was looking for. So, in our next video, we will be talking about another very common condition and very broad one, and it will be about food poisoning. So, guys, let's continue subscribing, let's continue liking our videos and commenting. And I know with you as my family, I will grow this channel to greater heights. Let's meet in the next video.